Any questions on a final exam? Is there any questions on a final exam?
That's what you said?
Yep.
No promises.
Okay, there you go. Remember how we spoke about, and there, by the way, the final basically accumulation of everything that we talked about, okay? All the chapters. So, remember we said there is how the ventilation has an effect on the cardiac, cardiopulmonary system and blood pressures and stuff like that. So, no, the mode that causes greatest reduction in the cardiac, reduction in cardiac output during mechanical ventilation, which mode is it considered to be? Okay. Question which is asking if you have a high tidal volume and a high level of PEP, which of the following can cause to the patient? So I have no effects of too much PEP or too much tidal volume during mechanical ventilation. Question, for example, normal volemic patients experience decrease in cardiac output above what level of PEP? Okay, there you go. Those are little fact questions. So now they're asking if your blood BP is otherwise stable, above what level of PEP. Otherwise, a normal patient should expect a drop in PEP level or a drop in blood pressure level. Which of the following patient conditions is least likely to experience hemodynamic change with high alveolar pressure during mechanical ventilation? Okay. Harmful cardiovascular effects of positive pressure ventilation are influenced most by which of the following pressures? Okay, harmful cardiovascular effects of positive pressure ventilation are influenced most by which of the following pressures? The first step in assessment and documentation of patient-vent interaction following placement of a patient on a mechanical vent is which of the following? Okay. The first step in the assessment and documentation of patient-vent interaction following placement on a vent is which of the following? Which one is it? You guys know? Good. There is such a thing as operational verification procedure, abbreviated as OVP. I'm not sure if the lectures touched upon maybe at the beginning of the term, but please check on that terminology. OVP, operational verification procedure, involves checking the vent circuit for leaks. Vent settings that could be used to perform this procedure include which of the following? Okay, when there's a procedure, when you're checking for vent leaks to get it ready to be used. So they're saying which settings, vent settings that could be used to perform this procedure are which of the following. Another fact question, probably from the book, okay? How often should FiO2 of an adult be measured? Generally, on a mechanical vented patient, how often do you measure FiO2? 2 hours. Pretty much right, that's the standard, but again, maybe the book says something specific, but in practice, generally that's what we do, at least 2 hours whenever you do the vent check. At least that's what I do. Okay, especially nowadays, ventilators are, they have analyzers built in, FiO2 oxygen percent analyzers built in the system. within the machine, so it's not like you have to physically go check something. Okay, it's a little different nowadays. Before, you had to. Nowadays, you don't. How long after beginning mechanical ventilation on a patient should arterial blood gas samples be drawn? There is another one. Okay. Again, look it up. You know, it will tell you what it is. Thank you. Everybody signed in, guys. Alexis. Derek, Henry. Good. Now, what do you need to do when it comes to a patient who is air trapped? Okay, on a mechanical vent, what options do you have? There is a couple of questions about that. How do you handle that? The body's mechanism for conducting air in and out of the lungs is known as which of the following? Body's mechanism, when you're just breathing. It's a weird kind of a question to confuse you more than anything. What do you call when patients inhale and exhaling on their own? Okay. Which of the following are involved in external respiration? Okay, so know that you know that's the beginning of the term question. Know what are the internal, external respirations mean? It's just a definition type of a question. Okay, which of the following are involved in external respiration? Know what are the you know, I guess it's part of anatomy. It's like anatomical anatomy type questions. Which body parts or organs involved in external respiration? That's right. Remember how the normal inhalation, spontaneous breathing takes place in terms of knowing how your pleural pressures change. Okay, how the pleural pressures change based on that. In terms of the pressures, you know, during spontaneous breathing, right? So make sure you know that. During exhalation, what happens to the pleural pressure, alveolar pressure, and during the exhalation, inhalation and exhalation. During spontaneous inspiration, what is the alveolar pressure? During spontaneous inhalation phase, what the alveolar pressures drop down to? Easy question, make sure you know. Because the alveolar pressures also, along with the pleural pressures, slightly change. Make sure you know that. The pressure required to maintain alveolar inflation is known as which of the following? Okay, what do you call the pressures that allow your alveolar pressures to, there is a definition. There's trans-airway pressure, transpulmonary pressure, all you know. Okay, those are little detailed definitions, and just asking you which pressure are the ones that associate with alveolar pressure, inflation of the alveoli. When alarm is activated on a vent, respiratory therapist's first priority is to do what? Legit question. Removing a patient from a vent to ventilate manually can lead to which of the following effects? Not bad. Okay. Very good. You have a patient initial step in the management of patient vent asynchrony is which of the following? The initial step. If patient vent, there is an asynchrony, which of the following? There it is. Remember we were talking about winning yesterday? And there is one nice question about that. What's considered long-term vent-assisted patients who require mechanical ventilation need to have how many hours for how many days to be considered long-assisted vent patients per ACCP definition? Okay? Terminology thing was part of the lecture. So for at least how many hours per day and for how many consecutive days they need to be on they require mechanical ventilation to be considered as a long-term vent-assisted patient. Okay? One of the goals of a long-term mechanical ventilation in home or alternative care site is which of the following? So make sure you know the goals of long-term mechanical ventilation, whether it's home or at rehab or subacute care. Which site for mechanical ventilation of patients provides the least patient independence and quality of life? Remember there was like acute facility, subacute facility and home care, and there was like a little definition which one does how much. I think that's what it's related to. So they're asking which side for mechanical ventilation of patient provides the least patient independence and quality of life. Okay. Question about the preferred location for vent-dependent patient is where? The preferred location. Another legit question, a patient with which condition is suitable candidate for home care ventilation? Home care ventilation. Do you remember how we calculated those little formulas when you had overall minute ventilation given and the PaCO2 at that given minute ventilation? And let's say doctor wants the PaCO2 to be 40 instead of 60 that it is on a given minute. What do you need to change your minute ventilation to? It's a formula. We wrote several of them for tidal volume, for respiratory rate. Remember they have different kinds.
You mean the desired, right?
Yes, it's about that desired formula. Okay, if a given CO2, let's say at 6 liters, is 70 millimeters of mercury. Doctor wants CO2 to be at 40. What is the new minute ventilation supposed to be at? Okay, kid? There you go. There is a similar question, but asking about respiratory rate. Those formulas are coming out. I don't know if you took that exam already for that one. Maybe it's going to be on these coming exams. If you have, you did already? Okay. But don't forget the formulas. Apparently, you see there is coming up on the finals too. Okay. Another question similar where they're asking about tidal volume. There you go. They have also seen one for the desired tidal volumes. Another legit question they have, what's the average tidal volume range? Let me see what units they're asking. In mLs per kilo, okay, for a patient, adult patient, otherwise who doesn't have pulmonary complications. Understood? In mLs per kilo. You also have a question Okay, so again, you have a patient with on a mechanical ventilator, respiratory rate and all that, tidal volume, they have the tidal volume rate, the mode, and ABG results based on that information. And based on the ABG results, they want to see which correction you need to make on the on the mechanical vent. Okay. Biotrauma, not barotrauma, biotrauma. Know the definition between the biotrauma, barotrauma. Okay. Biotrauma is caused directly by which of the following situations, conditions? A question about alveolar tissue and pulmonary capillary injuries is caused by which of the following? Legit questions so far. You know why? Because I had to review them too. I went over them.
Now that they changed the curriculum, you had to go over them?
What do you mean?
Oh, so this is like different than what we took when you took your class. So they changed
From the
all-
time you took?
Yeah,
Yeah, of course it's
so that's
changed
why I'm
many times.
asking, like, that's why you have to review them, because it's different?
Yeah, no, also I reviewed just to make sure I reviewed for the exam, all the exams you guys took, just to make sure at least the questions were more or less close to what we covered in the lecture. Because if I had left it, I could have left it just as it is and put it in a given the bank you have, and they would pick for you all the questions. But some questions weren't related to our lecture. At least this one's a little something you have heard. Shear stress injury. Okay, and loss of surfactant from resulting unstable lung units result in a loss of surfactant itself. This type of pulmonary trauma is known as what type of trauma? Legit question. Ventilator-induced lung injury is associated with which of the following? Little definition type questions. Okay, another nice question they have. Good. Another question they have, again, about the patient condition change while on a mechanical ventilator. Okay, and they're asking you how would you treat that or approach it. Nice question about what negative pressure ventilation means, and try to understand what happens to changes in the, thoracic cavity and everything to allow the air to come in. Basically, negative pressure ventilators cause air to enter into lungs by increasing which pressure? Okay, know how negative pressure works. A patient has acute pulmonary edema from left side heart failure. Okay, as responded to oxygen therapy or medications. As the next line of therapy, respiratory therapy should recommend which of the following? Nice question. One of the physiological goals of non-invasive ventilation in acute respiratory failure is to improve gas exchange by doing what? The primary goal of non-invasive ventilation in acute care setting is to do which of the following? So, that's part of the non-invasive part. Remember the waveforms, sinusoidal, sigmoidal, descending, ascending, square, and the stuff like that. Know those definitions, which one means what, by looking at the picture. They have different waveforms, and they might ask you which one is sinusoidal, which one is let's say square or decelerating or something like that. Understood? Know the definition of different possible waveforms you may have. The two waveforms that are common for pressure time for pressure scholars are which of the following? The two waveforms that are common for pressure scholars are which of the following? The most important factor to affect the degree of resistance in airway is which of the following? Know what affects the airway resistance? Or what can have the most significant effect to increase or decrease the airway resistance? You have several pictures of waveforms, okay, like flow versus time and all that, okay? And please, the peak in-story flow rates are basically to be able, by looking at a flow time waveform, interpret where is the highest peak flow at. Of course, they'll give you all the information. Be able to detect what's the I time gonna be by analyzing flow time waveform. Legit questions. You had those questions on your exam, during the waveform exam. A question is going to be, again, I think that's, again, a desired FiO2 type of a question, okay? Given a PaO2 and a given FiO2, and they're asking what FiO2 it should be, let's say if you want the PO2 to be 100, to go up to 100, okay? It's a formula question. Legit. And they have several questions like that about the FiO2 and PaO2 relationship. The goal of selecting a specific oxygen concentration is to try to achieve clinically acceptable arterial oxygen tensions within which of the following ranges? Following successful cardiac resuscitation, patient has been placed on mechanical vent, should have which of the following FiO2 set at? Interesting questions popping up. So far, so good. If we finish early enough, I might take you to the lab too, if we finish early enough. So we're doing good. We're almost halfway through. Easy. Okay, and another case situations about patient conditions and stuff like that, and how would you treat them? Patient has recently been diagnosed. Patient has recently been diagnosed with obstructive sleep apnea. The most appropriate treatment include which of the following? Easy. What's the minimum respiratory rate that's considered to be delivering full ventilation on a mechanical vent? Little definition questions. Partial vent support. Partial ventilatory support can be provided by which of the following modes? So know the modes and know what defines partial ventilatory support. Okay? Is it going to be, let's say, pressure control, ventilator, volume control with IMV, or pressure control with IMV? Which one is going to be qualified as a partial vent support. Okay? Which of the following breaths describing which one is considered spontaneous? Breath descriptions is considered to be spontaneous. And let's see what they mean by that. Okay, you know how you say spontaneous? Is it like is it time triggered or pressure triggered? What is a spontaneous breath on a mechanical vent? What triggers a spontaneous breath? There you go. That's already part of it. Or is it pressure limited, or volume limited, or patient cycle? What is it? Do you understand? Okay, now, there you go, easy. Know how to calculate minute ventilation. Know how to calculate an I time. Do you guys know how to calculate I time? If you have flow rate and tidal volume given to you? Good. Excellent. There is a couple of questions like that. Be able to calculate the I time given the tidal volume and the flow rate. Legit question. Be able to get to the point of calculating the IE ratio where you have given the tidal volume, respiratory rate, and the flow rate. What would the IE ratio be? That's an interesting one. Okay? All of the following patients are intubated and receiving mechanical vent, which is most likely to require slow liberation from mechanical ventilation. What does slow liberation mean? Basically weaning, yeah, they use like liberation term. So probably they have some data for you guys for some patient information, and they're asking you which one is basically the least candidate to be weaned off at that point. Legit. You have different time frames, a table with set tidal volumes, patient spontaneous tidal volumes, spontaneous rate and mandatory rates, all that given, and they're asking you what would you recommend based on the data that you're going to analyze, okay, for that patient. Seems like a more of a weaning type because of the mode used is SIMD mode, and you have some spontaneous rate information there and a volume for spontaneous volumes. So they're asking you what should you recommend, like looking at that data. Good question. I like it. Very nice question, but it's a straightforward. You should know the answer if you were paying attention. What ends or cycles the inhalation in pressure support ventilation? What does cycle mean? Ending, same thing, ends or cycles. What cycles? The inhalation while the patient on a pressure support mode. Very nice question. If you don't know the answer, do you have that vent sheet I gave you? Look at that sheet. At what pressure is pressure support not high enough? Remember, I spent some time talking about pressure support yesterday too, how it works and stuff. Anybody who's not clear how what pressure support does? We're okay? Feel free to ask, guys. This is the time. What pressure is pressure support not high enough to contribute significantly to ventilatory support, but is sufficient to overcome the work of breathing and the resistance? Is that a legit question? I think so. Which mode of ventilation delivers the exact amount of pressure required to overcome the resistive load imposed by the ET tube for the flow measured at the time? Which mode? Remember, we spoke about all these different types of modes yesterday. That's, by the way, it's a new topic. All these new modes that they listed on the yesterday slides, we didn't cover it before. We didn't cover in detail as much. It's a new thing coming up. So which mode is that? That's going to be specifically which mode delivers the exact amount of pressure required to overcome resistive load imposed by ET tube for the flow measured at that time. Is it the auto mode? Is it the volume target, PSV? Is it pressure support? Or is it the automatic tube compensation mode? Which one? Which measurement is usually or typically used to indicate right ventricular preload? Some cardiovascular questions. Know about how pulse ox is working, or how the pulse ox differentiates oxyhemoglobin from the oxyhemoglobin. A little mechanical question, okay? How the pulse ox functions. Also have a question, blood gas should be done to confirm pulse ox finding, no less than how many, minimum of how many minutes or hours, if needed. Pulse ox reading will be most accurate when used with patient in which of the following situations? Nice question about the pulse ox. They have a situation where they're talking about patient rescued from a fire. Okay. So they're asking what is the instrument that should be used to accurately assess patient's oxygenation in that situation? Very good question. Know how to troubleshoot pulse oxes? In case if they're not picking up accurately, you think that there is inaccurate, you feel like there is inaccurate, what should you do? Change the probe, do blood gas, or adjust the probe on finger, remove the probe, remove capillary refill tests, all that stuff. What's the option? Another good question about PaO2, FiO2 relationship, calculation, desired, given versus desired. Okay. There is another one about FiO2, PaO2. Nice. There is another one. How many variables can a vent control at one time? How many variables can the vent control at one given time? Know about the variables and how many ventilators are available. I think that's the beginning of the chapter 2 or 3 in Pilgrims, if I'm not mistaken. It's the beginning of the third chapter. An increase in air resistance during volume controlled ventilation will have which of the following effects? Nice question. Okay, very nice. Easy question, what do you call respiratory failure due to inadequate ventilation? Underlying physiological processes leading to pure hypercapnic respiratory failure is which of the following? Underlying physiological process. You're almost done. Not bad. You have another legit question based on ABG. Basically, it's an ABG interpretation. You have ABG results, you need to interpret it. Acute hypercapnic respiratory failure may be caused by which of the following? Probably they'll have a set of conditions. Ask you which one of the following can result in acute hypercapnic failure. And lastly, it looks like a hypercapnic respiratory failure due to increased work or breathing will be caused by which of the following? That's it. Okay? That pretty much covers our review. Let's do that. Let's take a 10-minute break. And then I'm going to take you guys, it's early. Only because I'd rather you cover everything in the classroom, then take the final exam. I mean, the both exams. So we'll go to the lab, okay? Maybe for 30 or so minutes. And then we go